All right, guys, I think we are ready to go. The topic for our webinar today is how healthcare providers and medical practice can improve their financial performances. Um, we will start with the firstly, I will introduce myself. I'm working for Cybrid for the last 6 years. I've been working with them as a practice management consultant and revenue cycle specialist. Just to give you a brief view about what we actually do. So we are basically a medical billing service company. We founded in 2009, and we've been practicing over 30 states and offering medical billing services to more than 100 practices within the US. Our medical billing expert teams provides billing services nationwide, and we also work to make sure we improve the cash flows. Our management team collectively have roughly around 5 decades of experience in managing the revenue cycle of practices from different specialties. This is something to brief you about Cybrid. The agenda for the whole webinar is how healthcare providers can improve their financial performances. So firstly, we'll give you an overview of US healthcare industry to get more understanding of what are the issues facing in the industry facing itself, and then we'll discuss the key performance indicators for the financial performances and how healthcare providers can improve these things. So that these 4 key performance indicators are revenue cycle management. The second one is improving patient experience. And the third one is increasing patients volume. And finally, the good financial insight of the practice. These are the 4 key performance indicators which we'll be discussing. So let's start with the overview of the US healthcare industry. Right. With the US healthcare industry, it has been seen an overall decline of 5.4% over the last 10 years, as you can probably see in the graph. This data has been taken out from ACM, which is basically an industry research organization which do yearly reviews on the healthcare industry and give a view of how the industry is performing itself. Now going through the next one, which is overall industry outlook. There's a few information which we want to discuss with you guys. Firstly, the overall cost for healthcare provider has increased by 9% in 2017. This is pretty steep considering the US healthcare industry. The second point is physician and clinical services have grown by 5.3% in 2018 compared to 4.8% in 2017. The only incline is only for 0.5%, but same with the hospital services, it grows to 4.9% in 2017 compared to 3.8% in 2018. Similarly, the another main issue which we come across was the Medicare and Medicaid reimbursement rates have reduced significantly from 21% to 42% over the few years. Another major issue we come across is 57% of doctors expressing concern about the financial insolvency of their practices. Another main issues which we have researched is 42% of physicians shows steep decline in their reimbursement activities. Similarly, 37% of the patients shows poor service experience. Another research by MGBA found that only 25% of practices are operating at peak performances. Looking through these healthcare outlook, it shows that overall the industry itself is going through a financial turmoil. But my main point was not to share these figures, not to scare anyone out, but to find out the ways to how we can improve the overall overall financial performance of the practices. Okay, so let's start with the key performances indicators to improve the financial performances. The 4 we discussed initially were the improving revenue cycle management, then improving patient experience, increasing patient volume, and finally ensuring good financial insights. If focusing on these 4 core activities, any medical practices or providers can improve their financial performance significantly. Let's go through one by one on each individuals and then see what are the issues they are facing and how we can improve these 4 performance indicators. So let's start with revenue cycle management. You can probably see the whole revenue cycle management chart in front of you. Revenue cycle management, just for some of you who probably don't know, is a process of handling claims, processing payment, and generating revenue. It's begin when the patients make an appointment and continues till the payment account becomes zero. The whole process is income to the identification, management, and collection of patient services revenue. Without these key financial process, healthcare providers cannot keep their doors open to treat the patient and I think it plays a major role for the providers itself in terms of finances. In the last few years, we have seen a number of healthcare providers have been facing financial stability and then challenges because of the reimbursement activities or the account receivable payments now or claim management, and all these activities which is a part of revenue cycle management plays a crucial role. So improving the revenue cycle management can significantly benefit the financials of the practices. Let's go through the issues in revenue cycle management which currently the practices faces. I've done my due diligence, and with the researchers we come up to some figures and some statistics which we have investigated, which right in front of you on screen, it shows that the top reason for claim denials is in most of the practices due to the eligibility issues, which is the first basic step in the revenue cycle management. Again, industry average for charges to collect ratio is between 35 to 40% of the billing charges. This is another significant issues in the revenue cycle management. Similarly, the average rate of claim denials are between 7 to 10%, which seems pretty steep considering and the considerable amount of revenue which can be lost because of the denials. Another report by Medical Billers and Co. to explain that poor medical billing practices can decrease their revenue by 30%. So it shows that the billing and coding plays a very crucial role for the financial stability of the practices. Similarly, another approach by the healthcare providers typically shows that the 8 to 14% of overall revenue of critical follow-up on rejection claims, which is another major steep financial draw for the medical practices to improve. Another major the investigation which we come across was practice front office failed to verify patient eligibility for 20% of the patients, which is another basic step of the revenue cycle management. I think if we look on all these issues and trying to improve on these ones can significantly improve the whole revenue cycle management process. So let's start with the suggestions of what we can do and how we can improve the revenue cycle management process for the practices. So you can probably see in my screen, it says how to optimize your RCM. So for you to step, I think the four basic steps or four major steps you guys can take is improve patient eligibility and verification process. This is the first basic step and the most crucial one. Secondly, you can start with improving the patient financial experience. When we talk about patients' financial experience, I mean how you can work with them and provide them with the facility to pay off. To make a payment. I mean, making it more convenient for them to make a payment. Similarly, managing claim denials effectively. Most of the organization, I think pretty much every organization will have some sort of claim denials or some ratio of claim denials. I think managing those claim denials effectively can significantly help the RCM process. Claim denials is a backbone for the RCM, and effectively implementing the claim the denials process will significantly reduce the issues which occurs in RCM. Similarly, another major thing which we want to optimize is consider outsourcing RCM activity. I mean, there's a lot of companies out there, same like Cybrid, who help clients who have a specialist team of medical coders to make sure that all the claims have been dealt with in an efficient manner. Whole revenue cycle management is optimized and the collection are done in promptly manner. So let's go through one by one on each process of each stage of each of these strategies, and then see what we can do to improve them. So start with the first one, which is patients improve eligibility and verification process. There's few checklists. There's a list of 5 steps which an organization or any health practices can use to improve the whole patient eligibility verification process. It is the first step and the most crucial one for all the organization. I think creating a verification checklist, which will play a major role for organization to improve it, such as insurance numbers, phone numbers, their claims addresses. This will help to minimize the initial mistakes which can be done. Similarly, get a copy of the patient's insurance card. It's a good idea to ask for a copy of the card even the patient state that insurance hasn't changed yet. But getting a front and back both sides of the insurance card details and save them into the EHR system will help to rectify any mistype information, and eventually help to reduce the claim denials. Similarly, the contact the insurance company directly to ensure eligibility. This will speed up the process, and rather than waiting through the EMR system, I think calling them directly will help to get the verification and also to streamline the whole eligibility process. So finally, I think follow with patients as needed. What I basically mean by that, if there's any questions or concerns you have, follow up with the patient about insurance information. So these things, these 5 steps will help you to significantly improve the eligibility and verification process for Similarly, now the next step which we're trying to speak of is about improving the patient financial experience. How an organization or a medical providers can improve their financial experiences. I think there's two main focus points, and they're a very crucial point. First one is focus on collecting payments. When I meant focus on collecting payment is basically, for example, when you go to the hotel, you take a credit card information at check-in. It's easier to collect payments at the beginning of the patient's visit rather than wait when the patient's left, having a treatment left, and then chase up for the payment. I think physicians should find ways to engage the patient as much as they can and help them understand their financial obligations. Make sure there's a price transparency, and by sharing with details of the services provided and the costs associated with those services. Also, another thing which providers can do is give patient alternative ways to pay, either by electronic bank payment or from the bank accounts or from credit card, cash check. I think more convenience where you provide the patient to make a payment, more chances you can recover. You can increase your patient collection, and then eventually improve the whole account receivable side of it. Now, the third most important point is managing claim denials effectively. This is a more crucial part. I mean, a lot of organization, most of the practices deal with some sort of claim denial ratios, how you can improve them. I mean, these are the 5 steps which you can take. Initially, start with the underlying cause. I mean, claims are not denied unless there is an important underlying reason for it. So understanding the underlying reason for claim denial is crucial to begin the process of efficient denial management. And I think then following through that, then you go to the next step, which is automation and streamlining of denials. How could you achieve that? I've seen numerous cases with medical practices trying to lose track of their medical claim denials, which can lead to the piling of denial claims. This makes it difficult for the office staff to keep track of the denials, and thus the practice may actually end up losing money. In order to avoid this, medical practice should automate their claim department, such as the whole denials management process can be streamlined. With this organized approach, it can be easier to keep track of the denial and to resubmit the request. Then follow this through. Then the next step will be weekly analysis and resubmissions. I think it's crucial to analyze what you are receiving on a daily or weekly basis or monthly basis. Reviewing your performance on a weekly basis or monthly or quarterly basis is crucial. It gives you an understanding of where you stand and where you want to go and where you want to achieve. So I think medical should ensure that workflow is efficient enough that all denial claims are analyzed, corrected, and resubmitted within the week. Prompt resubmissions ensure that the denial claims do not pile up, while also leading to prompt and timely submissions. Similarly, then you follow the next step, which is identifying the trends. I mean, why we are having issues with claims, why the claims are getting denied. So identify the trend. What are the issues? Is it because of the front office? Is it because codings are not being done correctly? All these things, once you identify the trend, and then you can work on to improve those, and then trying to find a ways to improve that will significantly help you to reduce your claim denials. And the final and most important point is to keeping up to the deadlines. There could be a number of reasons for medical billing claims. However, one of the most reasons for this is the deadline. All medical practitioners should bring in workflow system where the staff is trained to complete all the required paperwork and submit the claims within the dedicated deadline. This will help, I think, believe significantly to improve the overall denial process. Now let's talk about the 4th point, which is consider outsourcing. I think to improve revenue cycle management, a lot of big practices I work with consider outsourcing their medical billing services to ensure more collections. With an effective management of medical claims and hours practicing and look forward to improve their revenues. What our reason for, while the medical providers can outsource their medical billing services, the whole revenue cycle management services to the medical billing companies, they can significantly focus towards patient care, and that's to improve higher satisfaction. Higher satisfaction results in more patients care, and then more revenue for the organization. There's another major reason that where the provider can think of considering outsourcing is the recent report by the ACS, which suggested that with that 40 to 50% revenue can be saved on an annual basis outsourcing the medical billing services rather than having in-house. Another improvement that can be seen is the improved cash flows. By outsourcing medicals, using a medical service allow you to continuously steady flow of claims going through and cash coming in. That can significantly improve your cash flows within it. And with the reduction in overhead costs, the timely submission of medical claims, and the increased reimbursement, you can significantly improve your revenue. And similarly, you can also, while doing all these things, if your medical billing company is effective and good enough, they can help you reduce the billing hours and the hours with their expertise, knowledge, and so considering overall said, I think outsourcing the medical billing services can have a significant benefit for the whole revenue cycle management for the practices or the healthcare providers. Now our next part of the topic is the patient experience issues. Okay, with the patient experience, over the last few years, there's a lot of research been done, a lot of surveys been conducted by the healthcare providers, and the CMS and AMS surveys been conducted to identify the overall the patient experience within U.S. industry. So some of the facts which I'll be probably sharing with you guys right now in front of my screen is 47% of the patients shows frustration for long wait within the offices. This is the survey which is conducted by CMS, and which shows that 47% of the patients shows frustration for the long wait. Similarly, another survey conducted by the CMS suggested that 11% of the patients sense their doctors in hurry. They are rushing towards doing the service to treat the patient, and then going for it, which kind of improve the poor patient experience. And another major crucial thing which we found out was that 51% of the patients suggested that their relationship with their doctor could be better. I mean, there's always room for improvement, and then that could get better. Another result from the survey from AMS survey, which suggested that 62% of patients said that they deserve a better experience at the doctor office, considering the cost they are paying for it. I mean, looking through all these figures, we can figure out that patient experience plays a very crucial role, and then poor patient experience can result in reducing the patients coming into your doors, and that will be hitting your revenues. So I think implementing the efficient patient experience process is crucial for the overall practice financial stability. And now let's talk about the ways how we can improve the patient experiences. These are the 5 steps which I've come across and made up, which providers can use to improve the patient experience. So let's start with the first one. Make your practice look and feel engaging. What I mean by that, the patient will judge your practice before they even met you. So I think having a good impressions on the start with a well-designed, either through your website or to your office, or your the appealing of your office, like the cleanliness and comfortable office with amenities, to ensure that patient feel cared for and important in both the reception area, in the exam room, or over the web. I mean, these kind of the engaging activity the first look and the engaging activity is crucial is crucial for the practice to improve, and at the same time is a crucial process from the patient's perspective. The second main point which we're going to talk about is improve patients' waiting time. This was the top frustration, and there was another survey which was conducted, which says that 47% of the patients shows that it shows that a patient better informed. I mean, 47% of the there's another survey conducted by AMS which suggested that 47% of the patients shows frustration among the waiting time, as I've discussed earlier. How can you go and improve that? The best solution lies mostly in enhancing office efficiency and delegating appropriately to the office staff. However, keeping patients better informed of waiting time can also reduce the frustration and then maintain that goodwill experience within it. The third more point which you can improve on within the patient perspective is patient's feedback and satisfaction survey. I think collecting a patient feedback, physician can offer patient satisfaction surveys. I've got few samples which I will probably share with you guys once I finish this webinar, which will help you guys to get a better understanding of what your patients think about. I mean, giving the anonymous feedback will help you to make improvement within your practice. Similarly, the another more major step which you can use is make ease of access a top priority. This will start with well management appointment scheduling system. I mean, having a good scheduling system and a realistic templates, have enable appointment making. It will significantly help in improving the patient experience and the service your practice provided. Similarly, the another major final point is commit to timeliness. Be prompt in answering phone calls. Don't keep patient on hold, and don't jockey them around for one person or another. I mean, also be diligent in returning phone calls and email within a standard time frame. Communication is a crucial point in the patient experience, and establish good communication and then reinforcing all these accountable points will significantly improve patient experience overall. This is to do with patient experience. Now we're going to talk about how you can increase patient volume. Having a patient increasing a patient volume is crucial. I mean, having a patient is that's what you need to make money. How can we go about and improve this? These are 4 bullet points which I mentioned, which practice providers can use to help them increase the patient's volume. I've been through a lot of websites in terms of for the physicians and stuff, and most of the websites I went through were either simple, static, or less user friendly. So what I always go through and always recommend the providers and even to my own personal clients that having a good website and the interaction with the social media is crucial nowadays to increase your visibility within within your community or within your local boundary, and that will certainly generate the patient volume for your organization. So having a website nowadays is very crucial. If you don't have a website, there's a statistic which I was reading. It says that 72% of patients nowadays consulting the internet for healthcare information, and 62% using online reviews to find new doctors. Your online presence is very crucial. Chances are, if you are not online, maybe new patients aren't finding you. So beside building a beautiful practice website, there are few other things which you should do to significantly increase your online presence. That could be due to having a business directories, getting involved in social media. I mean, join networking groups. There's a lot of groups which you can join within your community, and then that will significantly help you to improve your online presence. What are the next steps you can do to improve that? I mean, positive reviews go a long ways. No more than ever, people are talking to internet. If you want to Google something and you want to, if you want to find a best restaurant, if you want to find a best healthcare provider, if you want to find a best place to go gym or fitness, whatever, you go through and you see the reviews for the practices. So similarly, when someone would probably try to go and look for you, will probably go and look for your reviews. And if there's not good reviews and not limited reviews, it will have a negative effect one way or another. So I think having a reviews or patient to post online reviews for physician is critical. The more positive reviews you have, the more likely that you will get more calls from the potential new patients, and that will give them a surety that the physicians or the healthcare provider they are reaching to with the positive reviews would end up giving them the best of the experiences. So this plays a very crucial role. The third more important thing is engage with your target audience. How you can engage with your crowd. I think you can probably join your community groups if any fundraising projects, or there's any charitable events, or you can always go about and do networking with your local community physician offices, or if there's a local community of physicians, you can join them, and then this will help you guys. It will help you guys to do networking, and doing networking will help you improve to better to have a word of mouth target, or to increase your target audience through word of mouth. This plays a very crucial role, engaging with your target audience, with your community, with your customers, with your business to business colleagues. That will help to increase your patients volume one way or another. Finally, don't forget to schedule follow-up appointments. Having a follow-up appointment shows the patient how much you really care about them and their health. Even when you haven't been able to make a final diagnosis for some reason, you should still encourage them to schedule a follow-up visit to discuss next step after the test results come back. This will help you to get this will help patients to get a more this will help you to get a more to get involved more with the patient and improve the overall patient experience. With that experience, you can increase the patient's volume. Just the last thing before I wrap up with increasing patient volume recommendation is it takes a lifetime to gain a patient, but a single second to lose them. Treating each patient like a family member will ensure that they keep coming back time and time again, and then that's very crucial for your practices overall. Okay, and that's what we got for the increasing patient volume. The next step would be ensuring good financial insights. What I meant with the good financial insights, that a lot of practices I work which they normally the most thing they care about is how much is the collection percentage, rather focusing on the other aspects, which give them a better view of how their practice is performing. So I think here I listed five crucial points in terms of financials, which practice can look into to get a better understanding of where they stand and where they want to go, and how they can build up a new strategy to improve that. So I start with the front desk collection range. Right, is the front desk collection rate is crucial point. It shows is the beginning points of is the first beginning point of the verification review process. Having a good understanding of this ratio will give you a significant understanding of where you stand in terms of your collection rate. Similarly, that the net collection percentage plays a very crucial role. Understanding that how much you have collected so far from your chargeable will give you a better understanding of how your collections have been done. Then again, the next step is the denial rate. Getting to know what your actual denial rate is, give you an understanding of where you're standing, and how much of the denial rates. Then going through the underlying reason for the denial rate. Why there's a lot of, for example, if there's a range of denials, and what's the underlying reason for the denial rate. Getting into to those nitty gritty will help you to understand, to get a more understanding of why the claims have been denied, and then you can come up with a better strategy to improve them, as I discussed above in managing denials. Again, days in account receivable is crucial for most of the practices. There's a 30 days, 60 days, 90 days, and 120 days of account receivable denials. I think getting a better understanding of where you stand in the 60 days, 90 days, and 120 days is very crucial. It gives you where you stand and how behind you are lacking in terms of accounts receivable. So getting a better understanding of your account receivable is very crucial. I would strongly recommend to start looking at your accounts receivable from 30 days to 60, from 60 to 90, and 90 to 120. 90 to 120 are more crucial days, because it shows that your account receivable has been lacking recently. So I think more focus on these 2 days in time frame will give you a better understanding of where you stand and why you're lacking behind it, and investigate it. Second, final, and last point in terms of financial health is the comparison. Year-to-year comparisons is very crucial. See where you stand last year and where you stand this year will give you an idea of how you're performing compared to last year's. You can do a comparison for years. For last 5 years, that will give you an idea of how you're performing. Are you going up, or is your revenue going up, or is it going down, or are you still in a steady position? That give you an idea of where you stand, and then give you an overview of where you're lacking in terms of accounts receivable, denial rate, your percentage of collections, and then through this making this improvement on these the above mentioned points, you can kind of figure out where you can have what strategies you can build up to improve the overall performances. So year-to-year comparisons and the rest of the 4 points which I mentioned it within the finance side will play a crucial role for you to understand where your the overall it will give you a good understanding of the overall practice performance. So look through these points as and build up new strategies to improve your performance overall. In terms of, I hope that all this what I've mentioned in terms of the practices will help you guys to one way or another to improve your financial performances. Uh, and if you guys have any questions and any suggestions, please go ahead and come into us, and then we were happy to answer those questions. All right, we have got a lot of questions coming in, and I'll be addressing as many as I could during this time window. And for the rest of the questionnaires, I will respond on the email if needed. The first question we have is, we are having issues with patient collection upfront. My staff as every patient when they visit, but sometimes the girls don't know how to collect. Okay. So answer to that I would say is you need to start verifying the benefits of each patient before the patient visit. This way you will have the copay for that visit, any deductible amount pending for that patient, or will that service be covered in the plan or not? Right. Okay, and now let's go to the next question. We are losing revenue due to now no-show patients. How can we decrease the no-shows? Okay, that's a really good question. The best way you can do this is you need to start the patient reminders. Your staff or your billing services should confirm appointment for each patient at least 48 hours before the appointment date. Cybrid MD provide this service as well. If you want to talk to us, just give us a shout. I will drop my contact detail at the end. If you've got any questions, feel free to ask. Okay, and the next question is, how can I know the denial rate for my practice and how my practice is performing? Okay, another interesting question. Your practice management system will have some reportings, and your billers need to run some reports within that practice management system to calculate the denial rate and other KPIs to analyze the health of your practice. Normally, it is responsibility of the billing company to provide them practice health dashboard. However, we can share a sample dashboard that Cyber and we share with its client on daily, weekly, and monthly basis to ensure transparency. What I will do is I will share all this information in terms of the dashboard with you guys at the end of seminar. I will probably drop you guys an email time to time, whatever the updates we get in terms of improving the practices, how to improve practice management. So I'll drop you guys some dashboard on these ones. The next question we have is, does your RCM team includes certified coders? I have a bad experience in the past where coding was not properly done, which affect my practice reimbursement. That's a very interesting question. Yes, we do. We have a certified coders, and they understand correct coding practice and keep themselves up to date from insurance policies, so providers doesn't involve into any problems and get the optimum reimbursement for the services we provide for. There's another question. What is the best approach to reduce the nows ratio? I like to understand if you have a system or process where all the claims go through some quality check before they submit to insurance. Okay, for that one, I would say our team perform analysis on the nows where we take an approach in a way that we can take proactive approach in order to stop denials. Our practice management system is smart enough to review all the necessary fields and claims and make sure that everything is correctly entered into the system before claims get submitted to insurance. Using proactive approach and smart system will reduce the denial ratio dramatically for your portfolio. I think, is there any other question? Okay, so another question is, giving the low reimbursement in Medicare, what do you suggest for increasing revenue? Sure, that's a very interesting question. First thing first, we need to be very careful in checking benefit for the patient having Medicare or Medicaid, so we can get to know any patient responsibilities, so we can collect that and inform patient when they come into office. and make to follow coding guidance for Medicaid and Medicare, as Medicaid is very complex in terms of coding, and they are very strict to the policies, and code are supposed to be updated with all the policies coming in. So I think that's hopefully probably answer your questions. And you also need to comply with MIPS and other value-based incentive procedures to make sure your reimbursement activity is up to the mark. Right? I think that's the all questions. That's all questions we got. Very interesting. Thanks very much, everyone, to joining us, and hopefully there was some learning from your side, and there was a lot of learning for us in terms of questions. And I would like to thank everybody for the time, and I will share the presentation with all of you after the webinar. I will also share the patient satisfaction survey for you guys to look into it. I will also share the dashboard which we use, been asked for, and our company profile if you got any questions. Yeah, that's it for today, and thanks very much, and I hope everyone have a lovely evening.